So your baby has had the procedure done and you've had a beautiful feed here with our lactation consultant and you go home. If your child is over 4 weeks of age, we recommend to give some paracetamol. If a child is over 3 months of age, you can also give ibuprofen. So the brand names for paracetamol, for example, would be Panadol or Dimedon. For ibuprofen would be Nurofen, as an example. You may need to give 1 or 2 doses the day of the procedure, maybe the next day 1 or 2 doses. By the 3rd day, pretty uncommon, and by the 4th day, rarely do parents need to give any pain relief. Most parents of the very young babies tell us they didn't give any pain relief at all. And if you're breastfeeding, the best thing that you can put in your baby's mouth is in fact breast milk, because not only is it nutritious for the baby, but it has antibodies in it and good pain relieving qualities as well. The day after the procedure, 24 hours after you've had the procedure, you will need to start doing stretches for your baby. We will show you a video on the day of what the stretches look like and also demonstrate them to you. But basically what it involves for the lip area is holding the lip or fingers underneath the lip, coming from behind the baby. So your baby is lying down and you're behind your baby, holding the lip, pull it out and up so that the lip covers the nostrils and touches the tip of the nose. Hold it there for 10 seconds. So it's one long stretch at the maximum lift of the lip with your fingers pretty close to the midline. Hold it there in that position for 10 seconds and release. Your baby won't like that, and of course your baby will cry, at which time it's then easy to get underneath the tongue. One hand holds the jaw open and the chin, another hand underneath with a finger underneath the tongue. Lift the tongue up, push it back towards the tonsils and hold it there for 10 seconds once again. Once that is done, you can give comfort to your child by giving good kisses and cuddles. We recommend not to do those stretches right on feeding time because you don't want a baby to associate these awful stretches with what should be a beautiful feed. And because it needs to be done 6 times a day for 2 weeks over a 24-hour period, if it becomes associated with feeding, your child might get an aversion. We call that oral aversion or refusal to breastfeed, for example. So we want to separate these awful stretches from what should be beautiful feeding. So the stretches are done 10 or 15 minutes before a feed or 10 or 15 minutes after a feed, but not right at feeding time. If you have a favorite spot at home where you like to feed, we don't do the stretches there either. And nor do we do them in your baby's bed, on the change table, or in the bath. Those areas need to be safe zones. So we mix it up where we do it at home. You might do it sometimes on the couch, sometimes on the table, on the floor, this room, that room, lights on, lights off, outside, in the car. Vary where you do it from a location point of view and time-wise as well, so that the baby doesn't get used to it, because it won't be long before your baby will quickly realize that you're approaching to do the stretches and will hold their lips together or hold the tongue down and you need to wangle your way in there. So we want to make sure that the stretches are not going to be compromising feeding. We have found that that protocol has completely eliminated oral aversion and breast aversion, so it's important to stick to that protocol. So the stretches are really important because if we don't do the stretches, the frenulum or the lip tie and the tongue tie can regrow. We call that reattachment. We see that fairly often. About 1% of the babies that we treat need to have a retreatment, relasering. And invariably it's because the stretches were not done properly. And that's one of the reasons why we like to check the babies at 1 week after the procedure. Because at that 1 week check visit, we will do a set of stretches for your child. And if there is a little bit of reattachment or regrowth, we can stretch it out. If that's the case, there could be a little drop of blood when we do that, but that's much better than having to have retreatment done. And of course, then we check the healing at 2 weeks, just to confirm that it's all healed up nicely. At that 2 week check visit, We may ask you to do a little bit more stretching, but it'll be less frequent. It'll only be usually 3 times a day, or you might gradually have to decrease the frequency of the stretching. We call that tapering off the stretches. But at least you won't need to do them overnight after the 2-week check visit. So yes, the stretches every 4 hours for the first 2 weeks, including overnight. You can have a 6-hour break overnight as well if that works well for you. So for many parents, for example, they will do a set of stretches at midnight and then again at 6 a.m. so they can get some decent sleep. Some parents tell me that they've tried to do these stretches while their child is actually asleep in the cot. For some babies that can work, and for other babies it's a disaster. So it's usually not our recommendation to do that. So the stretches, I can't emphasize how important they are to do. There are some other things that you may also need to do for your baby. For example, if there's a little bit of lip swelling because we've treated a lip tie, it won't be a huge swelling that may affect feeding, but you may notice a little bit of swelling. You can leave it alone and the swelling will go down by itself. It can take a few days. Or you can put some frozen ice chips underneath the lip to help bring down the swelling. Not an ice pack on top of the lip, however. Some parents like to use frozen breast milk chips underneath the lip, and that works quite well as well and can be nutritious. And we also know that the breast milk has got good healing properties as well. If there is a little bit of bleeding because the lip has been bumped, for example, it won't be a huge gushing bleed because there's no major blood vessels there, but if there's a little bit of a bleed, pressure on the outside of the lip, you need to hold it there for 4 minutes because that's how long it takes human blood to clot. And then you don't do the stretches for the next 12 hours because if you start to stretch it and there's just been a bleed, it'll just start to bleed again. If you've introduced solids into your child's diet, we just need to make sure that it's only pureed foods and there's nothing too salty, too spicy or too sour because it can sting in the mouth, and nothing with little seeds in it or crushed nuts. But that's only applicable, of course, for older children where solids have started. If your child has already grown a tooth or two, then normal brushing of teeth is fine, but we don't recommend to use toothpaste until your child is 2 years of age. Sometimes in the evening of the procedure, your child may get a little bit of a temperature. I'm talking about a temperature of, let's say, 38. If that's the case and your child is over 4 weeks of age, you can give some paracetamol or Nurofen. If a fever develops, let's say 4 or 5 days after the procedure, that could be a sign of infection, which is actually very rare with laser procedures in the mouth. Literally 1 in 2,000 patients in our experience will get a fever that is related to infection of a lip or tongue tie area. But if a fever does develop, please don't ignore it. You should take your child straight to the emergency department of a hospital because we want the hospital doctor to check your baby from head to toe for ear infections, sore throats, respiratory infections such as coughs and colds, or a tummy upset. Because the vast majority of the patients that we have seen that have had a fever, it's been because of something else, not because of the lip tie and the tongue tie. So don't ignore a fever of your baby. Don't ignore a fever where the temperature is 38 degrees or higher. If your baby goes to daycare or creche, we ask that you give permission to the carers at the daycare to contact us directly if they have any concerns with your child. You also need to give them permission to give paracetamol or Nurofen as appropriate, and you need to give them instruction on how to do the stretches. So they're still important to be done even if your child goes to daycare, and importantly, no playing in the sandpit at daycare either. If your daycare provides food for your child, it might be more appropriate that you provide the food during the 2-week healing period so that we can make sure that it's soft, doesn't contain any seeds, and won't be an issue for your child during that healing period.